Hello, my name is Simeon Neil Asher, and I thought today we would explore some trigger points connected to respiratory symptoms. Look, there are two things, aren't there? One of them is wearing these masks all day. I know personally, I feel out of breath. So when you're going to be treating people, we're going to look at that. And the other one, of course, is post-COVID and looking at some of the other respiratory issues that might develop trigger points. So I thought we'd explore those together today. So let's get started. So I thought perhaps let's start with the scalenes. So we're going to really look at the scalenes are accessory muscles of respiration. There are three scalenes: the anterior, posterior, and middle scalene, and each one of them has a slightly different trigger point pain map. Now, the posterior scalene starts on the second rib, anatomically, inserts to the second rib. And the anterior and middle scalene come from the first rib. But of course, they're going to be involved as accessory muscles of respiration in people either trying to get more breath in or people that are struggling to breathe in general. So the scalenes are certainly worth looking for trigger points, and the trigger points are quite profound, aren't they? I mean, the pain map can come all the way down to that thumb. It looks a little bit like a C5-6 disc sort of dermatome. The next one I thought we'd explore is the diaphragm and the erector spinae. So we'll start with the erector spinae. Erector spinae has three main groups, as we know: the spinalis, the iliocostalis, and the longissimus group. And it's really the iliocostalis group that we're going to look at now, because they insert into the costals, into the ribs. And they interdigitate with the ribs, and they work again with the obliques, and they share some of the fascial sort of planes with some of these other muscles. And they are accessory, also involved in respiration as well. So anyone that's having sort of COPD, COVID, anyone that's having respiratory issues, well worth looking for trigger points in the erector spinae. Interestingly, in terms of iliocostalis, it's also noting that we can get an anterior radiation pattern from the posterior fibers of the iliocostalis. Again, here's just another map for the iliocostalis thoracis taken at sort of the T11 level. You can notice that it can also be involved with mid-back and low back pain. So these are of course, the next one, we'll get to the diaphragm shortly, are the intercostals themselves. Three layers of the intercostals: the deep, middle, superficial. And the intercostals obviously are used with the diaphragm to really pump air into the lungs. And look at this pain map. So the pain map in terms of trigger points for the intercostals tends to be locally very much around the ribs themselves. Now, obviously, you're not going to want to put a needle or anything in that area. It's incredibly thin, the muscles, and obviously you risk pneumothorax. But there are a lot of different trigger point techniques, manual techniques, rib stretching, manual compression techniques for the intercostals themselves. In fact, while we're here, let's just look at the serratus posterior inferior, another one that easy to forget, but is a very big source of mid-back pain. You can check some of our other YouTube and Facebook movies for that. Serratus posterior inferior, again, accessory muscle of respiration. So someone that's wearing a face mask all day, someone that's been struggling with breathing, definitely worth checking there. Other muscles perhaps to look at are the obliques, because they have rib attachments. We can see the external oblique here interdigitates with the ribs, inserts into the fascia of the rectus abdominis. And look at this incredibly florid pain map that you can get for the obliques. The internal oblique, again, takes its origin here from the lower sort of border of the costal chondral cartilage, the lower ribs, and we can see that as well. Of course, we also have quadratus lumborum. That's another one to think about. That's from the lower ribs. And QL pain, again, QL is associated as an accessory muscle of respiration. Certainly can present with back pain. And there's really a whole bunch of them. Serratus anterior, don't forget, has rib attachments and functions into the shoulder blade and can be associated with rib and accessory muscles of respiration and shoulder pain. In fact, what's a nice thing here in the software is we can sort of put into the different poses, which is really handy for exploring some of these pain maps with the patients as well. So I guess that's an overview. There's one more, of course, which is the pectoralis minor. Pec minor muscle is very much involved in the sort of upper ribs as well. Of course, it's more of a shoulder muscle, but it is an accessory muscle potentially of respiration. So that gives you an overview of some of the areas to consider when people have come in either struggling after breathing, either they've had some kind of inflammatory or viral chest problem, and they're going to be struggling with some accessory muscles of respiration, or of course people that are going to be wearing masks all day. I know for myself, wearing these masks, I feel like I can't get sufficient breath in. So we're going to be struggling in using some of those accessory muscles of respiration. So that's the trigger points today. I hope you found that useful. Look, please like the video and subscribe to our YouTube channel. There's loads of stuff available on Facebook, and we very much thank you for coming, and we love having you here. Thanks for watching.